Good morning, everyone, and thank you for being here today. I am pleased to welcome you to this presentation on a comprehensive approach to batch reconciliation in sterile dosage forms. My name is Dr. S.K. Singh, and I hold a PhD in this field. Today, we will explore strategies and best practices to ensure accuracy and compliance in batch reconciliation processes for sterile products. Over the course of this session, we'll cover key concepts, challenges, and practical solutions to improve quality and efficiency. I look forward to sharing insights with you and engaging in a productive discussion. Let's talk about batch reconciliation. Essentially, it's the complete accounting of all materials used in a production process. This step is absolutely critical, especially for sterile products. Why? Because they pose a high risk to patients, particularly when administered via the parenteral route. And with sterile products, there's zero tolerance for contamination. Any lapse here can have serious consequences. Reconciliation helps us ensure traceability, so we can track every material through each stage, and provides sterility assurance, giving us confidence that the product is safe and uncontaminated. Now let's look at the stages of reconciliation. It starts with raw material dispensing, where we carefully measure and prepare the raw materials. Then, we move on to compounding, which involves solution preparation. Next, filtration and sterile holding are crucial steps to maintain sterility. After that comes filling, either through aseptic processes or terminal sterilization. And finally, packaging and labeling complete the process. It's important to note that reconciliation is required at each of these stages. This continuous process ensures integrity and safety throughout manufacturing, tying everything together to produce a reliable, sterile product. Let's take a closer look at the scope in sterile dosage forms. This applies to a variety of products we encounter in the pharmaceutical industry. For instance, injectables like vials, ampules, and prefilled syringes are included, as well as ophthalmic solutions that are used directly in the eyes. We also cover IV infusions, which are critical for delivering fluids and medications directly into the bloodstream, and lyophilized powders, which need reconstitution before use. When we talk about what this scope covers, it's quite comprehensive. It includes not just the active pharmaceutical ingredient, or API, but also the excipients. Those are the inactive substances that help stabilize or deliver the API effectively. Additionally, the scope encompasses the filters used during manufacturing, the stoppers and vials that contain the products, and even the labels and packaging. All these components are essential to ensure the safety, efficacy, and integrity of sterile dosage forms throughout their life cycle. Understanding this scope helps us appreciate the complexity and the critical quality considerations involved in producing these sterile products, which are vital for patient safety and treatment success. Let's take a closer look at the yield calculation. The formula here is straightforward. Yield percentage equals the actual output divided by the theoretical output, multiplied by 100. The theoretical output is based on the formulation, meaning what we expect to produce under ideal conditions. The actual output, on the other hand, is what we've actually measured during the process. This calculation is crucial because it helps us evaluate how efficient our process is and identify any deviations. If the yield is lower than expected, it might indicate issues that need attention. Now, moving on to the material balance principle. This is a core GMP equation, and it states that the material issued should equal the sum of used material, rejected material, samples taken, any losses, and returned material. What's important here is that these figures are based on actual counts, not estimates, ensuring accuracy in our process control. This principle helps us detect losses, mix-ups, or contamination, things that can compromise product quality and process integrity. And of course, adhering to this material balance is a fundamental GMP requirement, reinforcing the importance of transparency and precision in our manufacturing operations. Now, let's take a closer look at the filling operation. We started with an available bulk volume of 485 liters, which is used to fill 10 ml vials. If we do the simple calculation, Dividing 485,000 ml by 10 ml per vial, we expect to produce around 48,500 vials. However, in practice, we actually filled 47,800 vials. Additionally, there were 300 rejects, which are vials that didn't meet quality standards. We also accounted for 200 samples taken for testing and a residual loss of 200 ml, which can occur due to line residuals or other process losses. When we do the reconciliation, adding up the filled vials, rejects, samples, and residual loss, it totals back to our initial bulk volume of 48,500 units, confirming that our process is balanced and accounted for. This highlights the importance of tracking all these factors to ensure accuracy and consistency in our filling process, ultimately maintaining product quality and yield. Let's take a closer look at some examples of acceptable limits in our processes. For bulk loss, we're generally aiming for a range of 2 to 3%. When it comes to filling loss, the acceptable limit is usually up to 1 to 2%. As for component reconciliation, our goal is to reach close to 100%, ensuring minimal discrepancies. These limits are not arbitrary. They are based on thorough process validation, filter capacity studies, media fill data, and component reconciliation data. All of these factors help us set realistic and achievable standards. Now let's consider a practical example with rubber stoppers. Suppose we issued 50,000 stoppers. Out of these, 48,500 were used, 500 were rejected, and 1,000 were returned. When we add these numbers up, 48, 500 used, 500 rejected, and 1,000 returned, it totals exactly 50,000, which confirms our inventory accuracy. It's important to remember that maintaining these limits and conducting such checks is mandatory for all primary packaging processes. This ensures quality, consistency, and compliance across our operations. Now let's discuss deviations and investigation. When we encounter triggers such as yield outside limits, missing units or components, or unexpected gains, it's crucial to act promptly. These triggers indicate that something might be off in our process and require immediate attention. The actions we take start with an immediate line clearance check to ensure the equipment and environment are still within acceptable parameters. Next, we complete a deviation report in accordance with 21 CFR 211.192, which helps us document what happened and supports compliance. Finally, conducting a root cause analysis is essential to identify the underlying issue. It's important to remember that no batch should be released until these deviations are thoroughly resolved. This process helps us maintain product quality and ensure patient safety. Consistent investigation and resolution of deviations keep our manufacturing process reliable and compliant with regulatory standards. Let's talk about the key documentation requirements that support our quality and compliance standards. First off, the Batch Manufacturing Record, or BMR, is essential because it provides a detailed log of every step taken during the manufacturing process. Next, we have the Batch Packaging Record, or BPR, which documents all packaging activities to ensure traceability and accuracy. Sterile filtration records are equally important, as they verify that the sterilization process was performed correctly, maintaining the product's integrity. Reconciliation sheets are used to compare expected versus actual quantities, helping us catch discrepancies early. And finally, deviations and CAPA records track any deviations from standard procedures and document the corrective and preventive actions taken to address them. Throughout all of these, it's crucial to adhere to the ALCOA plus principles, meaning data must be attributable, legible, contemporaneous, original, accurate, complete, consistent, and enduring. This ensures data integrity is maintained at every step. Additionally, all entries should be made in real time, which helps prevent errors, supports transparency, and maintains the integrity of the documentation process. By following these practices, we ensure our records are reliable and compliant, ultimately supporting product quality and patient safety. Let's talk about some of the key challenges we face in sterile manufacturing. First, filter hold-up volume losses, which refer to the amount of fluid that remains trapped in the filter, potentially reducing yield and impacting efficiency. Then, we have line priming losses, where fluid is used to prepare the system before actual production begins, leading to some unavoidable waste. Next, aseptic intervention losses occur when we need to open or manipulate sterile systems during production, increasing the risk of contamination and sometimes resulting in product loss. Finally, breakage of ampules and vials is a significant concern, as it can cause product loss, safety hazards, and delays. To address these challenges, we need to implement specific strategies. Closed systems are essential. They help minimize contamination risk and reduce product loss during handling. Validated filtration is critical too, ensuring our filters perform reliably and consistently, maintaining product integrity. And finally, a robust contamination control strategy ties everything together, safeguarding the entire process from potential microbial or particulate intrusion. By understanding and managing these challenges effectively, we support the overall goal of producing safe, high-quality sterile products efficiently. So, to wrap up, the conclusion really emphasizes that reconciliation is absolutely critical when it comes to ensuring sterility and patient safety. It's not just a procedural step, it's a vital part of maintaining trust in our manufacturing processes. By performing thorough reconciliation, we can confirm complete material accountability, making sure every component is accounted for and nothing is missing. It also helps us detect any deviations early on, which is essential for preventing potential contamination or errors. Plus, adherence to proper reconciliation supports regulatory compliance, ensuring we meet industry standards and avoid penalties or setbacks. Ultimately, when we combine a robust standard operating procedure with precise calculations, the goal is to achieve zero discrepancies in sterile manufacturing. It's about creating a reliable, consistent process that safeguards both the product and the patients who rely on it. So, everything we do in reconciliation ties back to these core principles: accuracy, safety, and compliance. For further support, please don't hesitate to reach out to us. We're here to help you with any questions or additional information you might need. Remember, your success is our priority, and we're committed to providing the assistance you require. Thank you so much for your time and attention today. We truly appreciate your engagement and look forward to working with you further.